Can holding your poop in actually make it come out your mouth? Changing eye color may be a signal of this disease, and can doctors really treat STIs with malaria? Today, we're breaking down some of the most unhinged, fascinating medical questions pulled straight from the depths of the internet. All right, let's dive right in. If you hold your poop in too long, can it come out your mouth? The normal constipation, no. So when you're constipated, your large intestine, aka your colon, fills up with stool. If in the rare instance you are so constipated or blocked for some reason, I have seen cases where stool is coming out of somebody's mouth. Typically they're so sick that you're using a nasogastric tube or an oral gastric tube where the tube is actually in somebody's stomach and you're almost pumping their stomach, so to speak, and then fecal matter comes out that way. But it's not very common. But if it's really bad, sometimes people need to be sedated and taken to the operating room to have manual disimpaction done at that time. Can you actually survive in the wild by drinking cactus water? Sometimes. It all depends on the species. Some have drinkable water, but others are toxic. So you really need to be educated on what species of cacti you're looking at before you're actually going to drink it. Drinking the wrong water from the wrong cacti can, say, cause vomiting and be super risky and increase the risk of significant amount of dehydration and hastening your problem even more. I've read somewhere that fishhook barrel cactus that you could drink this, but the water is actually more acidic and can cause dehydration, diarrhea, irritation. So it's actually not something that is actually advisable. Why do we make you cough when checking for a hernia?
So any chance I could take you out for dinner tonight?
So commonly in like sports physicals, in the hospital, if you're having abdominal pain in your groins, you're checking for an inguinal hernia. A hernia is basically when a piece of tissue, we're most commonly talking about the intestines, but it could be other things, is pushing out of an area that it shouldn't be pushing out of. So we ask you to cough because it increases intra-abdominal pressure, and as it increases the pressure, if there is a weakening or a hole, we can feel those intestines trying to pop through them, thus increasing the risk of having a dislodged hernia or a hernia that actually comes out that can't be reduced. If you suffer from extreme migraines like I do, could drilling a hole in your head actually relieve migraine pressure? No. So there's a fancy medical term that we use for drilling a hole in somebody's head. It's called trepanation, and it has been used and still is used, but for different reasons. So ancient medicine, they would use trepanation all the time to potentially relieve pressure, but usually from, say, blood that's surrounding the brain. I've seen it done in the emergency department a few times when a neurosurgeon needs to get in to decompress the brain. What they will end up doing is something called a ventriculostomy, where they're basically sticking a tube into the lateral ventricle to decompress and take some of that fluid out, the CSF out, when there's so much swelling of somebody's brain. But to treat migraines, no, we would not do that. Is it true doctors used to treat STIs by giving people malaria? Yes and no. Not all sexually transmitted infections, but very specifically syphilis. And this was done before the advent of penicillin that we had, antibiotics. But what ended up happening was a doctor in like the 1917s, Julius Wagner, would use malaria to treat syphilis. And what the idea was, malaria would increase the body's temperature so much, high fevers, that syphilis was really sensitive to the high fevers and actually would kill that bacteria. I have a friend who craves dirt, like eating dirt. Is that normal? Societal norms, no, that is not normal. We should not be eating dirt, different micropathogens in there, but this is the form of pica. This is when somebody is craving something called a non-food substances like dirt. They're devoid of nutritional value, and so they're not good for us. You know, if you find yourself having these issues, it could be a deficiency as well. And I believe iron levels is the most common deficiency that you would have with somebody who has pica. So definitely get checked out by your healthcare provider. Is it true all babies are born with a hole in their heart? Yes, but hopefully that hole closes. So that is your foramen ovale, and that is a hole between your right and left atrium. So that way, when you are in the womb and you're getting blood from your mom via the placenta, but it's coming in, going back to your heart via the venous system in your body, so it goes to your right atrium. Normally, that would then go to your right ventricle and then be pumped to your lungs to get oxygenated by the air. You don't have air there. there. So that system doesn't need to happen. So what ends up happening is that blood that has oxygen in it skips that system, goes to your left atrium, then goes to the left ventricle, and then back out your whole system. But when the baby comes out and takes its first big breath, that change makes that foramen valley flap shut and heals on it. So then the normal circulatory system kicks in. I'm pretty sure my eyes change colors. So my question, doctor, is can your eye color change as an adult? Well, for most people, your true eye color typically sets in childhood. You know, babies are born, you can't really tell yet exactly what their true eye color is. There's like a little grayish hue to them. But then once the melanocytes, the color pigmentation sets in, it's usually set. Now, sometimes there can be a distortion or kind of like a color change of individuals depending on, say, the pupil size. So as your eye dilates or opens and closes, or dilates and constricts, the color of the eye might change a little bit. But if you are noticing that your eye color is significantly changing, this is something that needs to be checked out by a doctor. Why does it feel like I am falling right before I fully fall asleep sometimes? This sensation is something called the hypnic jerk, or a sleep start. It usually happens right as your body is about to fall asleep and you're having a contraction of your muscles that you're not doing on purpose, an involuntary movement. Typically occurs in 60 to 70% of the population that have it happen at least sometime in their life. So it usually happens with body stress, brain stress. It typically occurs in the first stage of sleep, non-REM sleep, because in REM sleep, your body's kind of mostly paralyzed, but you're having a lot of dreams, so your body's trying not to act out all those dreams that you're having, hence the REM sleep. And speaking of sleep transitions, one of the biggest triggers for hypnic jerks are stress and not being able to get a good night's sleep. If you're trying to build a more consistent nighttime routine, definitely check out Do Not Disturb at lifehappens.com or on Amazon. Are feet just undertrained hands? Like, should we be able to use them? Not really. As we evolved over time from getting around on all four to now just our feet, the structures of our feet became more rigid to support our bodies, so they're not as malleable, flexible, and have as much dexterity as they did maybe in the past, or as our hands have evolved to be. But there are individuals out there that might not have hands, or were born without arms or hands, that have trained their feet to be much more dexteric than somebody who's just walking on them. Can ADHD meds cause addiction later in life? Typically, no. ADHD meds such as Ritalin, Adderall, these are stimulant type medications, and when prescribed appropriately to someone who has a diagnosis of ADHD, that actually has been shown to reduce addiction in these individuals. And why is that? Typically, people who have ADHD have impulsivity issues, could go down the road, if not treated, to impulsing with drugs, risk behavior, substance abuse. So if somebody is appropriately treated with these other medications, the risk decreases. Is it true that women sync their periods if they are good friends? Oh, interesting questions. It was a study that actually came about in like 1971 by Martha McClintock, where college roommates were together and they noticed that their periods were syncing up by being in like the close proximity to each other. Science later has tried to do lots and lots of research on this, and they haven't been able to reproduce this exact finding. What they found was typically a woman's cycle, which does fluctuate, has a certain amount of time that it occurs in. So there are times when a period or menstrual cycle would overlap with individuals that are around each other, but they couldn't reproduce the exact month after month after month continued cycle. My girlfriend lets her dog lick her face. That's a no-go for me, but I'm curious, is it actually safe for your dog to lick your face?
This has got to be a new breed. Easy boy.
For most healthy people, it's low risk. There is bacteria in dog saliva, something called capnocytophagia, Pasteurella, and others. But if you have an intact immune system and you don't have open wounds and cuts on your face, the likelihood of something dangerous happening is pretty low. But if you have cuts, if you're immune compromised, so you have HIV, very elderly, or you're immune suppressed due to medication, probably would advise against it because you're just at risk for increased chances of getting an infection. So a question for you. Do you have any medical questions that are burning deep inside that you want to ask me? Let me know in the comments. Check out this playlist right here. Binge watch everything as best you can. And please make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.